Do you frequently feel like your heart aches sometimes, or notice your hands tingling out of nowhere? Maybe you're getting tired really fast, even after a good night's sleep. These might seem like small issues at first, but what if they're clues to something deeper, like a silent buildup in your body that you can't see? That's where amyloidosis comes in. Imagine your body is like a car engine, and proteins are the oil that keeps everything running smoothly. But in amyloidosis, some of these proteins go rogue. Instead of helping, they clump together like sticky goo in the wrong places. These clumps, called amyloid deposits, can mess up your heart, kidneys, nerves, and other organs without warning. Scary, yes, but understanding it early can save lives. Ever felt swelling in your legs and thought it was just long hours of sitting? It might be more than that. So, what causes these harmful protein clumps? Think of it like a factory mistake. In primary amyloidosis, your plasma cells, a type of immune cell, start making abnormal antibodies, like workers producing the wrong parts on an assembly line. These faulty proteins pile up as amyloid. Ever heard of multiple myeloma? That's often linked to this type. Now, secondary amyloidosis is like a response to long-term fires in the body. Chronic infections or diseases like tuberculosis or rheumatoid arthritis. Your body produces a protein called serum amyloid A, SAA, to fight inflammation. But if the fire never stops, SAA goes wild and turns into amyloid. Then there's familial amyloidosis. This one's inherited. If your parent has a faulty gene, you might get it too. It's like inheriting a broken recipe from a family cookbook. One wrong ingredient, gene mutation, and the protein, like transthyretin, doesn't fold right, causing damage over time. Now, how do you know if something is wrong? Let us play detective. Have you dropped your phone more often lately because your hands feel numb? That could be nerve damage from amyloid deposits. Do you get short of breath climbing stairs, as if your lungs cannot keep up? That might mean amyloid is stiffening your heart. Swollen legs, puffy face. That is often the kidneys struggling. They are supposed to filter waste, but amyloid clogs them like a blocked kitchen sink. Some people feel extremely tired, lose weight without trying, or even see their tongues swell up oddly. Others might pass too much urine at night. Your kidneys are leaking protein. It is like your body's warning lights, flashing one by one. The sneaky part, symptoms vary so much that many think it is aging or stress. But when multiple weird things happen together, it is time to dig deeper. How do doctors catch this hidden problem? First, they listen to your story, your symptoms, family history, other illnesses. Then they might test your blood and urine looking for abnormal proteins, almost like checking water quality for pollutants. A biopsy is often needed. A small tissue sample, maybe from belly fat, gum, or a swollen organ, is checked under a microscope. Imagine finding a fingerprint at a crime scene. This confirms amyloid. Organ tests follow ECG or echo. For the heart, kidney function tests, nerve exams. Now treatment, it's like tackling the problem at two levels: stop the bad protein at the source and protect the organs. For primary type chemo, like drugs, but milder, target the rogue plasma cells, similar to stopping a factory that makes defective parts. Secondary means treating the underlying infection or disease, put out the fire, and SAA drops. Familial may need liver transplant, since the liver makes the bad protein, or new drugs that stabilize or silence the faulty protein. Medicines like tafamidis or patisiran act like bodyguards protecting your heart and nerves. Can you avoid this altogether? For primary and secondary types, it's about managing health tightly. Have chronic arthritis or infections? Stay on top of treatment, like regular car servicing to prevent engine damage. For familial, talk to your doctor if relatives have neuropathy or heart issues. Genetic counseling is like a weather forecast. You can't stop the storm, but you can prepare. Regular checkups, watching for early signs, and healthy living, good diet, no smoking, less stress help all types. Think of it as upgrading your body's antivirus software. While you can't always prevent it, early action can slow it down dramatically. Ever done a home safety check? This is your body's version. Don't wait for the alarm to ring. Good news, science is moving fast. Imagine a drug that silences a broken gene, like turning down a noisy speaker. That's what drugs like patisiran, for familial type, do. They reduce bad protein production. New scans can now spot amyloid in the heart without biopsies, like an X-ray vision for protein clumps. Researchers are testing gene editing, like CRISPR, to fix the faulty genes causing familial amyloidosis. Future babies might never inherit it. Other studies focus on breaking down existing amyloid clumps, not just stopping new ones. Imagine a cleanup crew for the sticky deposits. Clinical trials are ongoing, offering hope. It's not just about living longer, but living better. You or your loved one might benefit from these advances. Ask your doctor about new options. The future, personalized medicine, where treatment fits